everybody, and welcome to Mom Talks on a slightly milder, maybe a little foggy Friday morning. We're so glad you're here as we're talking about how to make sure your kids are safe and warm this winter. I'm Kendra. I'm with the Media Relations team at St. Louis Children's Hospital. So glad you're with us. You might notice I'm dressed a little differently today. It is because it is St. Louis Blues Day here at the hospital. We love our Blues, and then we had some of the players here earlier this week, and also exciting announcement that St. Louis Children's Hospital is the official pediatric hospital of the St. Louis Blues. We're so proud of that partnership. Like I said, we love our Blues, our patients love our Blues players, and we are so excited to be able to celebrate our team here at the hospital today. And so today, like I said, we're going to be continuing our conversation about topics that always come up during the winter months. And today we're going to be talking about safety when you're doing some of those winter sports and just making sure that your kids are warm enough whenever it gets to be really chilly. It's hard to think about right now because it's actually so mild outside. But those cold, snowy days, kids want to go outside, they want to play, they want to build a snowman, and you don't want to end up in the ER at the end of the day. Usually not the goal. So I'm joined by Dr. Jamie Condis. She works with the emergency department here at St. Louis Children's Hospital. How are you today?
Good, thank you. Hello to everyone out there in social media.
Hello, cyberspace. So first I want to ask you, does the emergency room see a lot of business during the winter months?
Yes, definitely. I mean, obviously what we're talking about today, cold weather injuries, but we also see an increase in our infections in the winter months, things like flu and RSV. So I just want to put in a plug to get your flu shot if you haven't yet already. We've still, all the physicians still have them, but definitely we see an increase in people bringing kids in for cold weather related injuries, as well as concerns for cold exposure.
Okay, so for starters, there's a lot of fun sports that come around in the winter,
Yes.
and a lot of them involve being in a standing position, and snow is slippery, ice is slippery, and that can be falls.
Yes.
So let's talk about things like snowboarding and skiing. What kinds of injuries can a child sustain from doing those sports?
Definitely things like broken bones and concussions are big if you're not wearing the appropriate gear. So if you are becoming a skier or a snowboarder for the first time, obviously we recommend that you take some lessons and kind of get good at it. Most places will give lessons to kids as young as 4 years old, which you probably shouldn't be skiing or snowboarding younger than 4 years old. But even if you're, if you're going out there trying it, you should definitely, if you're a kid, wear a helmet. I know sometimes it sounds a little bit like overkill if you're a parent, but that helmet is really important. We see so many injuries in the emergency department that would have been a lot worse if they hadn't had a helmet on. Other protective gear you might want to consider would be things like knee pads and elbow pads. If you're going to wear those things while riding a skateboard or a scooter, then you're probably going to want to wear them while you're skiing or snowboarding too. And then one thing that people sometimes forget is eye gear. Especially if you're skiing, there's a chance of falling and injuring your eye, and also just to protect your eyes from the sun. Something that people really don't probably think about is when you're out there in the snow skiing or snowboarding, the snow makes a lot of reflection from the sun, and you can actually get sunburned. You would probably think, why would I get sunburned in December? But you really can. So you actually want to put on sunscreen too.
Wow, definitely not the season to get out
Right.
for sunscreen. Wow.
Yeah, you probably all packed that sunscreen away like I did, but you need to get it back out if you're going to be skiing or snowboarding.
It just reminds me that summer is coming. I'm not a big fan of winter. So what about sledding? You always talk about kids going down the hill. What are some tips about sledding?
Yes, so once again, you definitely want to have that helmet on. I know it probably seems like overkill, but if you crash in that sled, you're going to be so thankful that your kid had that helmet on. We recommend definitely sitting up on the sleds, not going down head first. I know that's probably what the kids want to do, but you want to be in a seated position with your feet facing forward. That way, if you run into a tree or you run into some sort of barrier, it's your feet that are going to hit first, better than your head. And if you can possibly use some sort of sled that maybe the kid can steer a little bit versus like those big round inner tubes that really don't have any sort of steering capacity. So if you can go for the more toboggan type of sled, that would be a little bit safer. And then definitely be aware of the environment that you're going to be sledding in. So we really don't recommend a real steep hill. If you could do something that's a 30-degree angle or less, that would be the safest. And then you want to make sure that when you're coming off that hill, you've got plenty of flat surface to then be on. You know, you don't want to be on a hill where all of a sudden there's a road there and you got to quick get out of the way. You want to make sure that you're really going to have an open space to land in. And you want to look around. Are there trees around? You obviously don't want to be having a lot of trees that you're going to have to avoid. So you really want to be in as open an area as possible.
I think that it's important for kids and also parents, if the parents are the one giving the push down
Yes.
the hill, kind of watching out, you know, of course, for the other kiddos that are around and things like that. So if you're riding on a sled and you're facing forward and your feet are in front, that means, Dr. Condes, that means you have to sit on it the right way.
Correct.
Sit down on it. That doesn't mean fancy tricks.
That's right, that's right. I mean, if possible, maybe you could even be on that sled with your kid, kind of supporting them, and then maybe you could bear the brunt of it if it crashed. But maybe not every parent wants to do that. Maybe they'd rather just watch. But yes, you do need to make sure that they're sitting on it appropriately. I know I'm probably kind of being a buzzkill for some of this fun, if there's any kids watching, but that really is the safest way.
Okay, so another thing that is popular around this area is ice skating.
Yes.
So, and a lot of times, you know, you can go to the rink, but there's also opportunities to go outside and go to like a frozen lake. How do you judge, I guess, if the ice is thick enough and if it's safe enough?
Right. Well, really the best way is to make sure that you're only skating on approved ice surfaces. So if it's an approved ice surface, then there should be someone out there from either the police department or the parks department that has put some sort of a sign that says it's an approved ice surface. And if there's not a sign, you should be able to call your local police department or parks department and ask if it is an approved ice surface. And if it's not, you really shouldn't be skating on it, because we don't have enough sustained cold days here in St. Louis to be sure that many of our frozen lakes and ponds are really safe. So there should either be a sign or you should be able to contact someone local to see if it's an approved ice surface, and if it's not, you really shouldn't be on it. And then once you are on that surface, even if it is an approved ice surface, you still need to obviously be exercising some caution. So I would recommend definitely staying with a group. That way, if there is some sort of a crack in the ice or something, there will be a lot of people around, so don't go off on your own, and try to skate in the same direction as everybody else. Don't do anything fancy. Don't try to jump in the middle or something away from everybody else, and just kind of be aware of your surroundings and really be paying close attention, because there is a bit of a risk there here in St. Louis where we're not like Duluth, where it's going to be negative 15 every day. So there is more of a chance that even those approved ice surfaces will crack.
And just a tip for moms is, when I was growing up, I remember there would be a flag flying if the ice was approved. I think it was like a green flag if it was okay, and a red flag if they said stay off of it. I see we have a question.
So even if it is below freezing outside, is it safe for children to be outside for short periods of time, or should they stay inside at all times when it is below freezing?
Yeah, that's a great question. There's no really set temperature, because you have to take some other factors into consideration. Paying attention to the wind chill is really important, which we get a lot of here in St. Louis. So if the temperature is below negative 15 degrees wind chill, kids should not be outside. You don't want your kids to be outside for even a really short period of time, if at all possible. But if you, for some reason, don't have a wind chill and it's kind of right around freezing, then you just need to use your best judgment. Obviously, you want your kids to be dressed for the warmth, which I know we're going to talk about. Yeah. So they can be outside for small periods of time unless you get below that negative 15 degrees wind chill. So you do want to be paying attention to that.
Yeah, that's a great question, and kind of piggybacking off of that question, I know wind chill factor can make it feel a lot colder. Are there any other factors that can make it either feel warmer or feel colder, and maybe might play into your judgment?
Yeah, so definitely if it's raining or snowing, that's going to cause a bit more of a problem, because once your kids get wet, they're going to be more at risk for cold-related injuries than if it's just a dry cold. So the humidity and moisture in the air is going to be important as well.
Okay, so say it's a nice snowy day and my kids want to go play outside. How do you layer your kids to make sure that they are warm enough?
Yeah, that's a great question. So you do want to be thinking about layers, like you said, because if you're just putting kind of tight clothing on kids, that's actually going to be worse, because if they do start to get cold-related injury, they're not going to feel it as easily if they're just wearing really snug clothing. So you want to dress them loosely in layers. And a good rule of thumb for little kids, because their skin is thinner than adults, and so they are going to be more affected by the cold, just like they would be more affected by the heat. So in cold weather, a good rule of thumb is dress your kids in one more layer than you would feel like would be appropriate for you. So if you're out there in 2 layers and you feel fine, then your little kid should be in 3 layers.
Okay.
You want it to be loose fitting clothing because again, you don't want them to be in anything constrictive because that might block them from actually feeling if they're getting too cold. So loose layers, definitely want to make sure that they're smaller parts of their body like their fingers and toes are really well covered because those are the parts of the body that are most at risk for frostbite. Anything that's at the ends of their body, so their fingers, their toes, their nose, their ears. Obviously it's kind of hard to cover their nose, but definitely you want their ears to be covered, you want their forehead and cheeks to be covered if possible because those are the areas that are highest risk for frostbite.
So I'm sure we all think of coats and we all think of boots. What about like, how important is it? I always hear they lose heat through their head.
They do.
Like hats and scarves.
Definitely. Not only because they lose heat through their head, but also because those areas are really at high risk for frostbite injuries.
Okay. I see we have another question.
So one of our viewers is wondering if you think your child has a cold-related injury, when do you go to the ER? When do you seek that help?
I think a good question, to go in with it is, when do you start noticing symptoms that maybe your child is too cold?
Yeah, well, there's 2 separate categories of cold-related injuries. So there's true hypothermia, which is when your body temperature has gone below 95 degrees because you've been affected by the cold. And then there's frostbite. So I can talk about hypothermia first.
Yeah.
Hypothermia is actually much more serious. Hypothermia can result in death in the most severe cases. So that's definitely a very serious cold-related injury. If your child is experiencing any symptoms of hypothermia, then you should really bring them directly to the ER. And symptoms of hypothermia are things like slurring their speech, kind of acting like they're drunk, moving around clumsily, falling over, or if they're a baby or a small child, acting very lethargic, meaning sleepier than usual, you can't arouse them as easily. Those are all symptoms of hypothermia. So if they're experiencing any of those symptoms and they've been out in the cold, just bring them to the ER for evaluation because there's a specific rewarming process we would want to do in an emergency department setting.
How does hypothermia, for lack of a better term, how does that happen?
Just prolonged cold exposure, either a long exposure to a cold temperature or a short exposure to a very extremely cold temperature. So in those, like I was mentioning, that -15 wind chill, that could happen actually pretty quickly if you're out there not well dressed. So it's actually pretty rare. I mean, we really don't see too many cases of hypothermia in the winter because most people do dress their kids appropriately.
And most people, if they don't want to be outside and if they don't necessarily want to send their kids out there.
Right. So the bigger concern that we actually see more often in the ER is frostbite injuries. So I can talk about that next.
Okay, so let's talk about finishing up our talk on hypothermia.
Yeah.
What makes it so dangerous?
Just that low body temperature. You never want your body temperature to be that low because really your organs start shutting down, and also it affects your brain. If you're acting inappropriately, you're going to make inappropriate decisions. So you have a more risk of falling or any injuries related to that. So, but once your core body temperature drops that low, it's really highly dangerous just for all of your organs.
And I would say, like, most parents might know the difference between, your child acting really weird and lethargic and something seriously alarming to like just, they're really cold, let's give them some chicken noodle soup, give them some hot chocolate, and they'll run right out.
Right. Yes. Most kids, once they start having those symptoms, I think parents are going to bring them in. And if they're not having those symptoms, they're not at risk of having true hypothermia.
So you mentioned frostbite a little more. So talk to me a little bit about what that is.
Yeah. So frostbite is exposure to the cold that's going to affect primarily your skin, and it's going to act like a burn. And you can actually think of frostbite as you would think of a burn in terms of management and in terms of how concerned you'd want to be. And just like how burns have different degrees, 1st degree, 2nd degree, 3rd degree, there's different stages of frostbite as well. There's 4 stages of frostbite, and the most common stage is the most mild stage, which is actually called frost nip. And that's when I think a lot of people have probably experienced this, when you've been out in the cold and your hands just start to look red and feel tingly. And usually you can go inside and warm those up, and you may not need to come to the hospital for that if you're able to safely rewarm them. The further stages of frostbite would all require a visit to the ER. That's when you actually see your skin becoming either gray and blistery or really hard and white and kind of waxy appearing. If you're noticing any of that in your child, those would all be situations where you would want to bring them to the ER. But if you're able to just warm them up, and I can talk about what you'd want to do for that, you wouldn't necessarily need to come to the hospital. You could give your doctor a call either way, but it's the later stages of frostbite that are much more serious.
And when you're talking about frostbite, are you talking largely about like fingers and toes, and you said ears earlier?
Yeah, the most common areas are going to be the smaller parts of the body that are kind of the end parts of the body, just because the blood flow is not as much to those parts of the body. So we don't typically see frostbite on like your cord. Sure. It's going to be smaller parts of the body.
And often is it because it's been exposed, like if my kiddo went out and tried to throw snowballs without gloves on?
Right. Well, part of the problem is that, and then also you get frostbite much more quickly if that part of the body is wet. So what we see a lot of times in kids who they go out and they play in the snow and their socks get really wet, and it might not really be that cold, but it's that exposure to the cold plus the moisture that actually makes frostbite more likely.
They've been kind of hanging out with it in their boots.
Cool. Exactly. And then or their gloves get wet, like if you said, if they're throwing snowballs, or sometimes if they're making snow angels, maybe their head gets wet. So, so the ears, the nose, the cheeks, those are real common areas for frostbite as well. The surfaces that you touch can also play a role. So if you have no gloves on and you touch something metal, you can actually get frostbite almost immediately sometimes if the metal is cold enough. So those gloves are really important.
You're making me think of a Christmas story. I don't know if you can get frostbite on your tongue.
Yeah, you probably could.
There you go. So kids, you heard it here. Because I did hear recently that a child tried to recreate having that stuck. So not a good idea, kids.
No, it's not.
Go play like you're in a different Christmas movie. So talk a little bit about when would a parent kind of know the difference between, okay, this is just, red and we just gotta warm this up, versus you mentioned the color, coming in. What are some other signs you might want to try to get in?
So definitely how the kid is describing the feeling is really important. So if it's a kid that's able to tell you, if they say it's feeling tingly, that's actually a good sign. So once they say they don't feel their extremities, that's bad. That's the time when you want to come in. But if they're still complaining of that kind of pins and needles sort of feeling, you should be able to rewarm that at home. And how you rewarm it is really important. So you actually want to put it in warm water, but not hot water, because too hot water can actually burn the child. Children, just like they get frostbite more easily than adults, also burn in hot water more easily than adults, again, just because their skin is thinner. So the correct temperature is about 104 degrees Fahrenheit, or if you don't have a water thermometer, like most of us don't, it's about the temperature that you would feel like if you were in a hot tub. So that if you can kind of judge it that way. So you can either put their hands in kind of warm water, or their feet, depending on what part of the body you're worried about. If it's something on their face, you might want to just use some warm washcloths and kind of make like a compress. But the water is important. You don't want to just put something hot on them, like a heating pad, because the child may not be able to tell if it's getting too hot, and then they could get burned. So you don't want to do a hot object. You really want to stick to the warm water. And then you want to give your child something warm to drink too, like hot cocoa or tea or something, because that will actually help too if they're ingesting warm fluids.
So talk to me a little bit about if a child comes in with frostbite. Now we're talking like a gray finger or not having any feeling. What happens at the ER?
Right. So the big thing you also want to remember in those situations is don't rub it. And that's the same in the mild frostbite too, because that can actually make it worse. When you're rubbing the skin, that can cause the skin to actually come off, and that friction is just not good for it. Another kind of old remedy I know people have talked about is putting snow on frostbite.
I remember playing Oregon Trail. I was like, why?
That is not recommended either. I'm not sure why people thought that was a good idea in the days of yore, but don't put snow on it. Just stick with the warm water. So again, you should be thinking of frostbite like a burn. You would treat it like you would a burn. So just if you do see them come in and they have blisters, just wrap it loosely. If you want to put something on it, you really don't need to if you're coming to the ER. But if you feel like you have to put something on it, antibiotic ointment is always a good choice. But don't put butter or mustard or any sort of home remedy, because they're just going to have to remove that in the ER. So it's really not helpful. But the best is just to kind of wrap it loosely in some loose cloths, or if you have gauze at home or something like that, and then come directly to the ER, because really that's what frostbite is a burn, and so you want to be thinking about it the same way.
What makes frostbite dangerous if quote unquote left untreated?
Yeah, so just like if you left a burn untreated, there's a risk of infection, obviously, because you've got that open skin. But the other thing that's risky about frostbite is it is essentially like you're cutting off circulation to the digits. So in the most severe cases of frostbite, you can actually lose those fingers. And sometimes that's not obvious right away. I mean, if you've got a kid that's, for example, walking around in boots and socks that have gotten wet, maybe they're not going to tell you right away, and by the time that you see that, it could be too late. So you want to be checking on your kids all the time and making sure that their socks haven't gotten wet or their gloves haven't gotten wet, because like I said, in those cases where the moisture gets involved, it can actually progress more quickly. So you really want to be keeping an eye on it, because that is the ultimate result, is that it could be like an amputation of the finger and toes. You don't want that.
Yeah, it's definitely not where you want to end up.
Right.
So let's kind of move on. We talked a little bit about the sports injuries. Now, obviously, even just going outside whenever it's a snowy, wintry day, a lot of times your sidewalks are slick, your parking lots are slick, walking into school, walking into daycare. So any tips on slips and falls and how to prevent them?
Yeah, it's tough, because I know around the winter here we've got a lot of black surfaces, blacktop on playgrounds and sidewalks, and it is really hard to see that ice. So, I mean, you just really want to be aware of what the temperature is when you go outside. Definitely have your kids wear some shoes that have good soles. You know, this isn't the time of year to be wearing the fancy shoes. You know, get some nice boots. Definitely, if your kids are walking to school, make sure they've got some boots with some soles. That's important for, you know, walking to school, for not slipping and for not getting frostbite. I usually send my kids to school in boots and then take shoes to change into, you know, for when they're actually there, because they can get wet so easily. Or tennis shoes with nice soles. And now's definitely the time of year to buy those new tennis shoes, maybe for Christmas, get some nice warm socks. And definitely, yeah, it can be really tricky. And maybe make sure your kids are not carrying a lot of stuff either, because that's going to make them kind of off balance. Some of the falls we see in the ER in the winter are actually parents who are carrying their kids because they think, oh, it's the right thing to do, that way my kid doesn't slip. But then the parent is off balance, and they end up dropping the kid, where if you think about it, it would probably be better if the kid had just walked, because if they fell from their own height, it's not going to be as severe as a taller person is dropping them. So the intentions are good, but it actually ends up being a worse injury.
So moms, maybe not the best time of year to wear your best high heels either. Sorry.
Especially if you're carrying that baby carrier.
Right.
Because you have to carry the baby, so make sure you're as well supported as you can be.
So when you're talking about slips and falls, are you often seeing broken bones, or what kinds of things do you see?
We do. We see broken bones, we see sprains, and then a lot of what we see is concussions, because obviously if you're just walking to school or if you're walking downtown, you're not going to be wearing a helmet, although that would be super cool if everybody wore a helmet all the time. But a lot of kids who fall, they hit their head, so we're seeing a lot of concussion injuries too.
We talked about concussions with the sports injuries too, and now we're talking about them again. How does a parent know, you know, when their child hit their head, like, okay, the concussion, or do they just bang their head?
Yeah, it's tough, but there are a lot of symptoms of concussion that they can be looking for. Headache is a big one, and then also, again, not acting right, kind of like when they have hypothermia. You know, they're going to be slurring their speech potentially. With concussions, a lot of times they complain that they're having trouble with lights, like light is making them feel nauseated or sick. Loud noises will oftentimes bother them, and they're just not able to function at their baseline. You know, maybe asking them to do math, and if they can't do that and they were able to before, that would be a good symptom. So those are some of the most common symptoms.
You know, sometimes parents talk about having like a goose egg on their head. Is that a symptom of a concussion, or is that a totally different thing?
Not necessarily. You can definitely fall and get a great big goose egg on your head and not have a concussion. The concussions are going to be more the complaints about the headache, nausea, and vomiting, acting lethargic, acting, you know, not at their baseline mental status.
So it sounds like with a lot of this it's just knowing your kid. I mean, if your kid's not acting right, go to the doctor.
Yes.
Otherwise, you know, you might be able to treat it home, but, you know, it's where that parent intuition comes back in, I imagine.
Right, and it's I would say it at least warrants a call to your doctor. You know, a lot of the kids, they come in with a concussion, and there's not a lot we're going to do for them other than observe them. For most mild, basic concussions, we're not going to be doing a lot of x-rays or head imaging. So you may not need to come to the ER, but at least call your doctor and discuss it with them.
Okay. Dr. Condas, thank you so much for being with us. So we are, believe it or not, getting closer to the end of our winter series, and next week we've got a really great topic. It's really timely for this time of year. We've got Christmas coming up, the winter holidays are around, and it's easy to get fixated, and this is kids and adults, on latest gadgets, latest toys, latest electronics. And so we're going to be talking about gratitude next week. And we have Dr. Lisa Harker coming in, and she's going to be talking about just instilling feelings of being grateful in your child, whether that's going out and volunteering or doing things with your family, or even just the basic courtesies of saying please and thank you. So we're going to be talking about that in the spirit of the holiday season. We also have Whitney coming in from the St. Louis Children's Hospital Foundation, and she's going to be talking about some great opportunities we have right here in the hospital to give back to the families who, you know, a lot of these kiddos who are staying here with us are going to be here over the holidays. So some ways that everybody out in the community can kind of gather around them and make the holiday season a little brighter for them. So that's going to be next Friday at 11, and we'll look forward to seeing you there. Have a great day, everyone.